Imagine doing your job day after day, as always, but on payday, you don't get paid. How would you pay your rent, your electric bill? Well, that's what hundreds of Maine healthcare providers, therapists, optometrists, chiropractors, and more say is happening. They say one of the country's largest insurance providers, Anthem, has left them hanging. It's a story we first told you about in October. And Chris, you've been digging into this. What went wrong?
Well, Amanda, since our first story, we've heard from dozens of healthcare providers, including two of Maine's largest hospital systems. They're all bringing up the same issue, a delay in payments, which means they are struggling to pay their own bills. Now, our state's Bureau of Insurance is looking into the problem. So how does this affect you? If Anthem's not paying your doctor and you use Anthem as your health insurance, your doctor may be less likely to take you in for an appointment or keep you as a patient.
And all of a sudden, it was almost like a shoot of like hundreds and hundreds of piles of letters from Anthem.
Rosemary McCullough is one of the hundreds of therapists waiting for her money. One of her partners had been out tens of thousands of dollars for months.
So this person's had no salary for several months.
No salary?
No salary, except for self-pay patients. And then when we started talking to other people, we realized, in fact, there's up to hundreds of people being affected by this. It's not a problem on the end of the provider.
In June of this year, Anthem posted on its provider communications page for Maine that it was upgrading one of its billing systems in July. It's called a provider data management system. A healthcare provider, like a therapist, puts their unique ID number into the system to make sure they get paid for the patients they see. That ID number is called an NPI, a National Provider Identifier. Anthem said the new system would improve provider data accuracy and transparency, as well as enhance the provider experience and provide more accurate pricing and processing. The insurance company said that new system would launch in August. It warned users that those NPIs must be put in correctly or the claims would be denied.
Rosemary and other coworkers say they paid close attention as they submitted claims and still got denied.
We have a contract with Anthem that we will be paid. We have not been paid. It's been months.
Therapists like Rosemary have spent hours on the phone trying to get all these claims resubmitted and paid. Some, like Quinn Morehouse, had to hire her own billing specialist to take care of it all. She says nearly 90% of her clients have Anthem insurance.
For myself, I do my own billing, but this just felt way above my level of expertise.
It's the number one issue that I have. It's a constant, 30 to 40 emails a day just on the Anthem issue right now. This is just basically a week.
It's not just therapists. Maine chiropractors, optometrists, physical therapists, and even two of Maine's largest hospital systems, Maine Health and Northern Light Health, all say they've experienced issues with getting paid on time or at all. We are hopeful that Anthem will respond to the urgency of this situation in the very near future and provide financial relief to all who have yet to be reimbursed for their services, wrote a Maine Health spokesperson. Even New Hampshire's insurance department confirmed similar problems. In an October communication to providers, Anthem acknowledged the delays, saying these delays are due to several factors, including hiring challenges related to the pandemic and a new provider data management system. We sincerely apologize for these delays. We strive to process and pay claims as quickly and efficiently as possible. Anthem said it prioritized claims from Maine, sent extra resources, and hired more staff to help Anthem workers in Maine deal with the problem.
Something this important should have been better communicated, and I think that's a fall down on their part.
Robert Reed is the executive director of the Maine Chiropractic Association. He has worked for several insurance companies, including 10 years at Anthem Blue Cross.
There's no consistency in how they process the claims. I can take a provider providing the exact same service over 8 different visits, and 3 will be paid and 5 will be denied. And that's the frustrating part for our providers, is they're doing exactly how they're told to do.
Anthem declined to do an on-camera interview, but sent us this response. We have been and remain in close contact with the Bureau of Insurance on this matter. We apologize for any delays this may have caused. Now, the Maine Bureau of Insurance is involved because of how widespread the issue is.
When it's broader than that, we do have an interest in that because it has an effect on consumers.
The effect on consumers? Providers may stop accepting Anthem insurance, meaning people will have to pay out-of-network rates or out of pocket.
Will you continue to have a contract with Anthem?
Great question. We'll see what happens. We'll see what happens from here on out. This cannot continue. This has to be fixed.
Now, these therapists we spoke to say they were nervous to come forward, concerned about what would happen if they did. Now, since we interviewed them, some of them tell us they're starting to see large amounts of their claims get paid back. One of the therapists we talked to in October says he got a call from Anthem this morning, promising him at least a partial payment today. Anthem says over the last 12 months, it has processed 92% of claims within 2 weeks and 97% of claims within a month. But this does not stop at the provider level. It could affect you, the patient. We'll explain how after the break.